Led by doctors Camilla Sasson and Jason Smith, two teams set out on a journey to Los Angeles, California to investigate a new program at the West LA VA. Camilla's team was looking for an innovation to spur an infant addiction service in the Denver Emergency Department. Jason's team was looking and trying to find a formula for providers to be successful with their patients. Doctors Neil Patel, Joni Shao, Manuel Celadon, and Larissa Mooney are innovators, rethinking how and where veterans receive care for opioid use disorder. If we were going to learn anything about how West LA was successful, we would need to go to the source. Dr. Manny Celadon is the youngest staff physician in the ED and one of the best. Manny explained to us why he became a physician.
The reason I became an emergency doctor is because my idea of a doctor is somebody who knows the whole scope of medicine, and from acute care to ambulatory, non-acute care.
This was crucial. It paints a picture of the type of physician for which the VA has come to be known. It would also be key to the origination and formation of an opioid use disorder treatment program in the emergency department. The first of its kind in the VA. Our question to Manny was why he thought he could treat addiction without any formal training.
The world as it is now is a lot of patients get their care in the emergency room, and I do a lot of primary care in the emergency room, even though that wasn't my training. So regardless of whether this is helping them for their diabetes because they're hyperglycemic and helping them get connected to endocrine clinic and starting them on insulin or metformin, or whether it's asymptomatic hypertension and they're not on any blood pressure medications and helping them get started and follow up, opiate use disorder to me is the same thing.
Understanding this attitude was very important, but it wasn't the only step to treating this disease. A catalyst was needed. Manny turned to his colleague and friend, Joni Shao, Associate Chief of the Emergency Department in LA. Off camera, she shared her secret to success.
I'm not a talker though, but I get things done.
Yeah.
But
how do you get things done?
I ask a lot of questions. I pick things in my mailbox. I don't throw away anything until it's done.
Dr. Shao had been at the West LA VA for many years before she was approached by Dr. Celadon to innovate a new practice. When asked what she thought of Manny's idea, her candor demonstrated a willingness to change.
To work on this issue.
I think the interesting thing is maybe a year ago, I was in the same kind of group where opioid withdrawal, it's not a life-threatening illness. We just need to give them symptom control, and that's that. And I think increasingly we realize that this is an opportunity to really help the veteran, help the patient overcome the withdrawal if they're ready and willing, and that realizing what MET can do and the different drugs out there, there is a better way to do it and a better way to make patients, stay sober from their addiction. We worked with Dr. Mooney in particular, and the chief of our substance abuse clinic, who basically explained to us the drug, specifically Suboxone or buprenorphine, and understanding how safe it was and how relatively easy it would be to try to induce someone in the ED. It seemed like a perfect opportunity to really, again, engage the veteran in their care long term, and something that we could honestly relatively easily do in the ED with enough support from different ancillary staff.
Her attitude changed when she witnessed what she described as miraculous.
And that's when we've seen veterans patients realize, wow, there is an alternative to what I'm doing here that will work for me, and this is a way out of my addiction. And that's what's really, really miraculous and wonderful to see.
Drs. Sasson and Smith needed confirmation that the role for addiction specialists would remain a critical part of how providers would expand their emergency departments. Specifically, they wanted to know care would be provided to patients who would most likely benefit from timely intervention. Camilla and Jason turned to Dr. Larissa Mooney, Chief of Addiction Services at GLA.
Well, the emergency department is a point of entry for treatment. Many times people with addiction aren't necessarily in that moment seeking treatment for their addiction, but they may come to primary care or an emergency department for a medical problem or a medical consequence. So if at the same time as they're receiving treatment for their medical condition, they can be identified as having opioid use disorder, that's an ideal place to start treatment if it's available and if it's appropriate.
GLA had in part realized success from a collaborative environment with specialists like Dr. Mooney, who felt strongly that all providers could have critical discussions with veterans and treat opioid use disorder. Dr. Sasson and Dr. Smith pushed her on the issue.
It's everyone's responsibility because addiction is a chronic illness, and we are right now facing an opioid epidemic where we need a lot of creative solutions and rapid solutions. And in fact, the number of cases of opioid use disorder in this country cannot readily be handled by specialty clinics. The volume is too high. So we need to remove barriers to treatment, work together, work as a team to provide continuity of care and really bridging that continuum of care across specialties, moving from ED outpatient, sometimes ED to inpatient, residential treatment to aftercare and outpatient. These are, depending on the needs of the veteran, of the patient, they may need more structure, they may need less, they may stabilize very quickly, but if we all think about what is our role, what can we do, is there a small part we can play, even if it's just initiating that treatment and then linking them with longer term treatment, that can be very meaningful.
It was then clear that everyone at the GLA VAMC had a stake in treating OUD. Their teamwork was infectious. We asked Dr. Sasson what had inspired her about this campaign.
I think, why should emergency department providers be thinking about naloxone? I had a case of a veteran who we had a NAT response in the parking lot in our facility, and I responded to it, and I realized myself and the two techs and a nurse that had come with me, we actually ended up pulling a veteran out of the car physically, and his friend who had brought him to the VA had said, I think he might have overdosed on opioids. And so we put him on the stretcher as fast as we could. We ran down the hallway, and it was far. And the whole time I was thinking to myself, oh my gosh, this is a patient who truly needs naloxone, and we may not be able to get to him in time. We were able to run as fast as we could. We got to the emergency department. We'd called ahead and said, hey, can you guys grab the naloxone? I think this is an opioid overdose. And fortunately, we were able to give him the medication right away. Didn't have to intubate him. He responded within seconds of administration of that medication. And as a provider, there's very few things that are so gratifying in terms of being able to truly have that person who you're helping from sort of save from that brink of life and death. And to me, that was one of those things where I kept saying to his friend, look, if you had waited 3 more minutes to call us, your friend would have died. We do a lot of things that sometimes you kind of wonder, am I making a difference? Am I going to make an impact? And I really do think that has made an impact, not just on him, but more importantly on me.
Our team had stumbled upon something unexpected. We captured in Los Angeles just what we were hoping to find. Doctors that were dedicated to the mission and doctors that had personal responsibility for every veteran they encountered. It would now be our responsibility to bring this spirit back and share it with as many people as possible. When asked to offer a statement as to how they were able to create a program like this with little resources and no additional staffing, each provider answered the same: it's our job. The Academic Detailing Service from VISN 19 would like to say thank you to the providers that participated in this unique event. It was our pleasure to be of service.